The fluorescent lights hummed their constant electric prayer, a sound that had become as familiar to Katie Rodriguez as her own heartbeat. 6:37 in the morning. Seattle General's ICU corridor stretched empty and pale, the kind of quiet that only exists in hospitals before the day breaks open. She moved through it with the economical precision of someone who'd learned efficiency under fire, her white sneakers silent against linoleum that smelled of bleach and something older, something that never quite washed away, copper and fear, the metallic ghost of every crisis that had unfolded in this unit. 8 months. 8 months of keeping her head down, her past buried, her rank erased. Just a nurse. That was the narrative she'd written, and Seattle General had accepted it without question. Katie Rodriguez, quiet competence, excellent chart notes, always the first to respond when monitors screamed. They didn't know that the woman adjusting their 4 lines had held a field hospital under mortar fire in Marjah for 16 consecutive hours. They didn't know that the tremor some of them noticed in her left hand wasn't weakness, it was the scar tissue of nerve damage from an IED that had also taken 2 fingers and most of her hearing in her right ear. Her hearing aid was barely visible beneath her tied-back hair, flesh-colored, practically invisible if you weren't looking for it. Most people weren't. Most people saw the hand first, that 3-fingered left hand missing the ring finger and pinky, and their gaze would linger just a fraction too long before they looked away, uncomfortable. They'd make assumptions. Old injury. Accident at home. Kitchen knife. Car door. Anything but what it actually was: shrapnel, fragmentation grenades, and a young captain who'd crawled 40 meters through enemy fire to reach her, only to find she was already reaching back toward her patients. She pushed open the door to the supply room, and the smell of sterile packages and rubber tubing filled her lungs. Her hands moved across the shelves with surgical precision, gathering the materials she'd need for morning rounds. Saline flushes. For catheters in 3 gauges. The 14-gauge angiocath needles. Gloves in the box marked M. The motion was automatic, muscle memory, the same way her body knew how to move through a trauma bay or a hostile compound. You learned one way to work, and your muscles didn't forget, even when your rank did. The break room was empty. Katie opened her locker, the bottom one, corner position, perfect sight line to anyone entering, and placed her bag inside. On the shelf above her stethoscope sat a single dog tag on a broken chain. The tag itself was tarnished silver, stamped with a name and a number that wasn't hers. She ran her right thumb across it, just for a moment, just enough to feel the raised letters. Then she closed the locker door and let the hinges swing shut without a sound. Some things were better left unwashed. Some things were better left in the dark. Katie made her way to the nursing station and logged into the computer. The morning handoff report loaded slowly, streaming data about the 8 patients in the ICU wing. Cardiac post-op pneumonia follow-up. Stroke survivor. Standard cases, routine monitoring, the baseline work that kept hospitals breathing. She scanned the names with the habit of muscle memory, looking ahead to what the day might demand. Her eyes paused on an admission note timestamped 11:43 p.m. the previous night. New patient. Stable. Transfer from emergency department. Trauma history noted. Requires monitoring for complications related to undiagnosed aortic dissection risk. The name hit her like cold water, Colonel James Hartley. Her hand stilled on the keyboard. 30 seconds passed. Her jaw clenched, just once, just barely visible, but she didn't move. Didn't pull back from the desk. Didn't reach for her phone or the break room coffee or any of the small tells that would show her hands were shaking. They weren't. They weren't shaking at all. The tremor in her left hand was purely neurological, permanent, one of those gifts that kept on giving. Colonel James Hartley. Her son's commanding officer. The man who'd pulled Marcus out of an ambush in Helmand Province 2 years ago. The man whose voice she'd heard once, crackling through a satellite phone at 3 a.m. when Marcus was calling home from a forward operating base to say he was alive. Marcus called home once every 14 days if the comm equipment was functioning. He called when Colonel Hartley was his CO. That had mattered. That had felt like divine insurance. The shift supervisor was reviewing charts at the desk beside her. Katie kept her breathing steady, kept her eyes on the screen. "Bed 7, she said quietly. "I'll take the new admission." "Rodriguez," her supervisor said, not looking up. "You're full." "Bed 3 needs pain management assessment. Bed 5's family is asking about discharge timeline, Anne." "I can manage," Katie said. "I know Colonel Hartley's case history." It wasn't a lie. She knew his case history because her son had mentioned him exactly once, and Katie had spent 6 months researching the man online, reading declassified commendations, watching him age into the authority his rank required. 38 years old in his military photo. Distinguished Service Medal. Purple Heart. Command authority over 11 operational Delta Force personnel. The kind of officer that people didn't question. The kind of man that lesser men feared. The kind of officer that Dr. Ashford would definitely fear, which meant Dr. Ashford would definitely try to control. Katie was drawing medications from the Pyxis at 8:42 when she first saw him. "Dr. Ashford." He swept past her the way certain men do, occupying more space than his body actually contained, his white coat expensive and crisp, a Rolex catching the fluorescent light like an advertisement for decisions he'd made about himself. He didn't acknowledge her. Men like that never did, not when there was actual work to be done. They acknowledged other doctors, the charge nurse if she was attractive enough, the hospital administrator if she controlled their schedule. A nurse with a 3-fingered left hand and a hearing aid practically invisible in her hair. She existed in the background, part of the fixtures, no more noteworthy than a blood pressure monitor on the wall. His expression would change when he looked at her hands. That was always the sequence. The eyes would register the scarring, the missing digits, and something would flicker across his face, pity or disgust or, worst of all, contempt. The contempt meant he decided she was broken. Broken things couldn't be trusted. Broken things needed supervision. Katie pushed the medication cart down the corridor, her movements controlled and precise. "Bed 1. Bed 2. Bed 3. She checked vitals, documented everything in the electronic medical record, spoke quietly to patients and their families. Her voice was soft, her demeanor practiced, her presence the kind that made people feel calmer just by existing in the room. That was a learned skill too. You learned it when you needed to keep people alive who were scared they were dying. You learned it when your job was to be the steady thing. Bed 7. Colonel James Hartley's door was open. The room smelled like hospital, plastic and saline and the chemical tang of cleaning solutions, but underneath it was something else. Gun oil, maybe. Or the smell of someone who'd been in places where soap was a luxury. Katie stood in the doorway for exactly 1 second before she moved forward, not long enough to look hesitant but long enough to be certain of what she was seeing. He was awake. Watching the ceiling with the kind of stillness that only certain men possessed, the kind that came from understanding how quickly everything could change. Military bearing even in bed. Even with an full line and a hospital gown and his left leg elevated for swelling. His eyes flicked toward her. Military training again. Always aware of entry and exit, always tracking movement in his space. "Good morning, Colonel," she said quietly. "I'm Katie. I'll be your primary nurse today. Rodriguez." He processed the name like he was running it through a database. His eyes moved to her left hand as she reached for the blood pressure cuff, and his expression didn't change. Didn't soften. Didn't harden. Just registered and filed away. "You know my name. Your chart's in the system," Katie said. She positioned the cuff, noting the slight discoloration along his ribcage. Bruising. Deep bruising, the kind that suggested impact trauma. "And you're assigned to our ICU, so yes. I know your name." He watched her work. Watched how her 3-fingered left hand steadied the cuff while her right hand fastened the Velcro. Watched how the tremor in her left hand didn't affect her accuracy. Watched like he was seeing something specific, something he recognized. "How long?" he asked. "Your stay? Your service?" Katie didn't pause. The blood pressure cuff cycled, measuring his pressure at 156/92. Slightly elevated. Stress. Pain. Possible medication side effects. 12 years, she said, and her voice didn't change. 3 tours. Medical discharge. The Colonel's eyes met hers for exactly 2 seconds. In that 2 seconds, something passed between them, recognition of a language spoken only by people who understood what it meant to stay standing when everything inside you was screaming to fall. Then he nodded. Once. And looked back at the ceiling. Katie documented his vitals and made notes in the chart. BP elevated. Responsive. Alert and oriented ×3. She was reviewing his medication list on the portable tablet when she noticed it. The dosage for the post-operative pain management was written in Dr. Ashford's handwriting, and it was wrong. Not just wrong, dangerously wrong. The dose calculation suggested he'd either made an arithmetic error or didn't understand the patient's renal function numbers. The drug would accumulate. The drug would build. By this evening, the Colonel would either be oversedated or experiencing paradoxical pain escalation, and by tomorrow morning, there would be a potential for respiratory depression. It was the kind of error that didn't usually matter because someone usually caught it. But sometimes no one did. Sometimes they let it slide. Sometimes a doctor's ego was more important than precision, and a patient paid for it in confusion, pain, and complications that cost months of recovery. Katie pulled up the Colonel's lab values on her tablet. Creatinine at 1.1, eGFR at 78. Dosing renal adjustment was definitely indicated. She moved to the medication cart and opened Dr. Ashford's most recent order. The math was there, naked and obvious. He'd written 8 milligrams when the appropriate dosage given renal function was 4 milligrams. She pulled up the override screen. 2 hours until the next scheduled dose. 2 hours to correct this without making it a dramatic thing, without making it a confrontation or a scene. She modified the order in the system and printed a new label, her movements economical and quiet. Mistake caught. Problem solved. No one needed to know except the system, which never talked, and the Colonel, who definitely already knew. But that wasn't the worst part. Dr. Ashford appeared at the medication cart just as she was about to administer the corrected dose. He'd changed out of his expensive coat into scrubs that probably cost more than most people's monthly rent. His presence made the air pressure change, that particular authority that came from knowing you'd never truly been told no by anyone who mattered. Rodriguez. Not a greeting. An acknowledgement of existence. What are you doing? Administering the 0800 pain medication for bed 7, Katie said. Colonel Hartley. His eyes moved to the 4 line in her hand, then to the medication label, then to the override in the system that she hadn't hidden because there was no point hiding it. Any doctor could pull the log. Any doctor could see what had happened. That's not the dose I ordered, he said. Katie didn't move. The syringe was poised, ready, her 3-fingered left hand steady as a surgical laser. Your calculation didn't account for renal adjustment, she said quietly. Creatinine at 1.1 requires dosing modification. The corrected dose is 4 milligrams. The room went so quiet you could hear the ventilator breathing for the patient in bed 6 down the hall. I'm aware of renal function, Rodriguez, Dr. Ashford said. His voice had gone very smooth, very controlled. The voice of a man who wasn't used to being corrected by anyone, let alone by a nurse with a scarred hand and a hearing aid. I don't need a nursing assistant explaining pharmacology to me. The word assistant landed between them like a blade. Katie administered the corrected dose. The fur hissed slightly as the medication flowed through the line, the saline burning just a little, the way for pain medication always did. Colonel Hartley didn't flinch. He watched Dr. Ashford watching Katie with the absolute stillness of a man assessing a threat. I'm a registered nurse with a bachelor's degree from the University of Washington, Katie said quietly. The dosage adjustment is per hospital protocol. It's documented in the system. Interesting, Dr. Ashford said, and smiled. It was the smile of a man who'd just decided something. We'll discuss this more formally, Rodriguez. Count on it. He walked away before she could respond, his footsteps sharp and deliberate on the linoleum. Katie finished with the 4-line, checked the medication drip one more time, and stepped back. She didn't shake. Didn't go pale. Didn't reach for the wall to steady herself. She simply moved on to the next task, the next patient, the next requirement of the shift, while Colonel Hartley watched her with the intensity of a man who'd just seen something that changed his entire understanding of the room. Dr. Ashford entered Colonel Hartley's private room at 2:53 p.m., and the air pressure changed. Katie stood at the 4-pole, adjusting the pain medication drip with the precision of someone who'd read the dosage calculations 3 times, cross-referenced them against the patient's weight and renal function, and caught the error that would have stopped the colonel's breathing by midnight. His wife sat in the vinyl chair near the window. His adult daughter stood at the foot of the bed, holding his chart. Neither woman noticed the moment Katie's spine straightened, the moment she recognized the expression on Ashford's face, the expression of a man who'd just realized he'd been corrected by someone he'd already decided was beneath him. Nurse Rodriguez. His voice cut like a scalpel. Did you alter my orders? Katie met his eyes. Calm. Steady. The kind of calm that comes from having already survived things that would break most people. Doctor, the dosage you prescribed would have caused respiratory depression. The patient's creatinine is elevated. The math was. I don't recall asking for a consultation from Stumpy. The words landed like a physical blow, but not to Katie. The colonel's wife flinched. His daughter's jaw clenched. Katie took one measured breath, in through her nose, out through her mouth, the way she'd been taught in field medicine courses where men were dying and panic was a luxury nobody could afford. Her 3-fingered left hand remained steady on the 4-pole, steady as a sniper's when the target is 1,200 meters downrange. The math was incorrect, Dr. Ashford. Her voice came out like calm water over stone. I have the calculations if you'd like to review them. His face flushed crimson. The kind of flush that happens when a man's authority is questioned in front of witnesses and he realizes he can't bully his way through it because the woman standing in front of him isn't flinching, isn't backing down, isn't giving him the satisfaction of visible fear. What I'd like is for nursing staff to stay in their lane. Perhaps if you hadn't lost those fingers, you could write notes clearly enough that I wouldn't have to waste time deciphering your chicken scratch. A single tear escaped Katie's left eye. Not from pain. Not from shame. From the precise calculus of restraint, the understanding that crying in front of this man would be worse than anything he could say, because it would give him what he wanted. She wiped the tear without breaking eye contact, her gaze holding his like a laser sight on a target. I've seen better men than you break under less pressure than a clipboard. The silence that followed was so thick you could operate in it. Ashford's jaw clenched so hard she could see the muscles working beneath his skin. The colonel watched from the bed with the intensity of a predator reassessing prey. His wife's hand moved to her mouth. His daughter pulled her phone halfway from her pocket, as if she'd just realized she was witnessing something that might matter later. Ashford turned without another word. He walked to the nurse's station, pulled a form from his tablet, and began typing with the deliberate aggression of a man who decided that if he couldn't win through argument, he would win through institutional power. His fingers moved fast. His jaw remained locked. Katie watched from the doorway of the colonel's room as he filled the form with the careful documentation of a man building a paper trail, creating a record, constructing evidence. Then he posted it on the unit board where every nurse on the floor would see it. Rodriguez, insubordination, a protocol violation. The words were printed in bold. The details were sparse, clinical, and utterly damning, unauthorized alteration of physician-prescribed medication without consultation. Repeated insubordination when corrected. Patient safety concern flagged. The head nurse averted her eyes. 2 younger nurses whispered behind their charts, their voices dropping to frequencies that were intended to be inaudible but traveled on hospital air current like smoke. Katie stood at the medication station, verifying another patient's insulin dose, 250 units of Humalog, right dosage, right patient, while the weight of the right up settled across her shoulders like a physical thing. 30 minutes later, she sat alone in the break room with her lunch. Leftover rice from last night. An apple. A bottle of water that cost too much from the vending machine outside the ER. The table where fur nurses usually congregated went quiet the moment she sat down. One by one, they stood. Gathered their trays. Their phones. Their dignity. They crossed to the opposite side of the break room and resumed their conversation, their laughter, their existence in a space where Katie Rodriguez apparently no longer belonged. She ate each bite with methodical precision. Each grain of rice. Each segment of apple. Her back straight. Her breathing steady. Her hands moving with the control of someone who'd learned that emotion was a luxury that got people killed, so you compartmentalized it, filed it away, and continued with the task in front of you. The fluorescent lights hummed overhead like insects in a cage. When she stood to leave, one of the nurses, Jennifer, the one who'd smiled at her during orientation, looked away. Another one busied herself with her phone. The third one actually turned her chair to present her back. It was coordinated enough to be intentional. Ashford had orchestrated this with the precision of a surgical team. Post the write-up where everyone could see it. Then let his allies handle the rest. The social destruction often cut deeper than the professional one. Katie walked back to the floor at 3:19 p.m. Colonel Hartley's room was on her route, and she stopped during evening rounds to check the line and verify the new vitals. His blood pressure had dropped 8 points since morning. His heart rate had climbed 12 beats. His breathing pattern was subtly irregular, the kind of irregular that most people wouldn't notice, but Katie had spent 2 years in combat medical positions, and she'd learned to read the body's whispers before they became screams. That's when she saw it. On the bedside table, partially hidden beneath a folded newspaper. A dog tag on a broken chain. Gold-colored metal catching the late afternoon light streaming through the hospital window. The tag was identical to the one her son Marcus wore beneath his dress uniform, the one she'd seen hanging there during his last leave when he'd stood in her kitchen at Fort Bragg before deploying to the Horn of Africa with his unit. Delta Force. Bravo Squadron. Her son's commanding officer. The same man now lying in this hospital bed, and Katie had been cut off from his care because she'd saved his life and Ashford had decided that was a liability. She didn't reach for the dog tag. She didn't acknowledge it beyond a single glance. But her three-fingered hand gripped the edge of the forestand for exactly 2 seconds, and her breathing changed, that barely perceptible shift from hospital rhythm to something deeper, something controlled, something that came from the part of her that understood exactly how personal this had just become. Ashford watched from the doorway. She could feel his presence the way prey animals feel a predator's attention, a shift in air pressure, a change in ambient threat. He was already planning, already strategizing, already moving pieces across the board like he was the only one who understood the game. But he'd made a critical miscalculation. He'd assumed Katie Rodriguez was just a nurse. He'd never once considered what it meant that she was her son's mother, that the colonel had apparently traveled with his dog tag to Norfolk, that the broken chain might connect to something far larger than a simple medication disagreement. He'd seen weakness, a disabled woman, a quiet nurse, damaged hands that couldn't possibly threaten a physician's authority. He didn't see the veteran. He didn't see the rank she'd earned. He didn't see the field thoracotomy she'd performed using a combat knife and a 6-inch incision when there were no scalpels and a Marine was bleeding out and she was the only one with hands steady enough to save him. Katie finished her rounds at 4:33 p.m. She pulled up Colonel Hartley's chart on the nurse's station computer and added an observation to the nursing notes: subtle decline in systolic BP, elevated HR, irregular respiratory pattern. Recommend additional cardiac imaging to rule out aortic complications. She flagged the note for physician review. Standard protocol. The kind of thing that nurses did every day when they noticed something off, when their instincts, honed in places where wrong decisions resulted in body bags, screamed that something was deteriorating. At 4:19 p.m., Ashford reviewed the flag in the system. He read her note. Then he denied the CT scan request with a single click and added a note of his own, nursing staff overreach. See previous disciplinary action. No additional imaging required at this time. That's when the email came through. Schedule change. Effective immediately. Katie was being reassigned to the pediatric floor for her next 3 shifts. A new graduate would be taking over Colonel Hartley's care. A nurse who was smart enough not to question physician orders, who didn't have a history of insubordination, who wouldn't catch the errors that Ashford had already made and was probably still making. Katie sat at the nurse's station and read the email at 11:03 p.m., her 3-fingered hand gripping her phone so hard the screen flickered. The rotation was intentional. The timing was deliberate. Ashford had done what he did best. He'd used institutional power to silence dissent, to remove obstacles, to ensure that the one person on the floor who might have caught what was coming next would be somewhere else when it happened. She closed the email. She finished her shift. She drove home in the rain to an apartment that was too quiet and too empty, and she didn't cry, and she didn't call anyone, and she didn't break protocol by reaching out to a patient's family, because that would give Ashford exactly what he wanted, proof that she was unhinged, unstable, inappropriate. But she did pull up her son's unit roster on her laptop. She did look at the photo of Colonel Hartley standing beside Marcus at Fort Bragg 6 months ago. And she did understand, with the clarity of someone who'd spent her life reading the coded language of institutional power plays and medical hierarchies, that Ashford had just made the mistake of his career. He'd moved her away from the patient without understanding why she was there in the first place. Her hearing aid caught it first, the sharp electronic wail of the code alarm from the ICU, 3 floors above the cardiac unit where she'd been reassigned to the graveyard shift. Katie was restocking the crash cart on the 2nd floor when the sound cut through the ambient noise of the hospital, that specific frequency that meant someone's heart had stopped being a heart and started being a problem that required immediate intervention. She froze for exactly 1 second, her right hand suspended above a box of epinephrine vials, listening to the amplified chaos filtering through her hearing aid's directional microphone. The alarm was coming from the north wing. 3rd floor. ICU. She knew which room before she consciously registered why she knew it. Colonel James Hartley's room. The same room where she'd spent 8 hours the previous day watching Ashford write a prescription for a dose of morphine that would have stopped the man's breathing entirely, if she hadn't caught the decimal point misplaced like a loaded gun in a hospital that believed in hierarchy over mathematics. The same room where that broken dog tag sat on the bedside table, identical to the one her son Marcus wore under his shirt, a promise between operators that someone would come home or someone would carry the news. Katie abandoned the crash cart. She didn't run, not yet. Running would draw questions, and questions were the enemy of forward momentum. Instead, she moved with the controlled urgency of someone responding to protocol, her pace just slightly faster than walking, her limp pronounced as the old shrapnel in her left hip sent its familiar complaint down her thigh. The injury had cost her half her hearing and 2 fingers, but the Navy doctors said she was lucky. She'd never liked that word. The stairwell door opened onto the 3rd floor, and she could hear it now even without the amplification, the raw panic of a code in progress, the shouted orders that mean someone is dying in real time while machines count down the seconds they have left. Nurses moved like organized chaos around the ICU unit, and she could see through the glass partition into Hartley's room, his wife Sarah pressed against the back wall, her hand over her mouth, his vital signs on the monitor displaying the kind of numbers that appear in medical textbooks as teaching examples of catastrophic failure. The new graduate nurse, barely 2 months into her first position, name tag reading Jennifer, stood frozen at the bedside, staring at the colonel's chest as if her confusion might somehow reverse what was happening inside his body. And there was Ashford, still in his button-down shirt and tie even at 2 a.m., his voice cutting through the chaos like a scalpel, "Someone get this man to the OR. Now. Start compressions, get 2 lines in, we transport immediately." Katie's eyes moved across the monitor display in the span of a breath, blood pressure 58/32, plummeting. Heart rate 142 and climbing. The kind of vitals that meant something inside the colonel had catastrophically failed, and it wasn't his heart itself, it was what his heart was trying to pump through, and she'd seen this pattern before, in a field hospital outside Marjah where a Marine with a dissecting aorta had gone from talking to dying in the time it took to draw up a second unit of blood. She stepped into the room. Nobody stopped her because in a code, nurses move in the gaps of authority, and Katie moved like someone who understood exactly where those gaps existed. "His aorta," she said. The words came out flat, informational, the voice of someone reading a monitor rather than making a diagnosis. "Type A dissection. He'll arrest before he reaches the OR." Ashford's head snapped toward her. She could see the exact moment he recognized her, could see the chemical reaction in his face, anger first, then something worse, fear that she might be right. "You're not assigned to this floor," he said. His voice had that quality it always carried when he was frightened and trying to hide it, stretched too thin, the words running together like watercolor. "Security. I need security in here now." Katie moved toward the crash cart, her left hand reaching for the thoracotomy kit even as her right hand reached for the scalpel. The hand with 2 fingers instead of 5. The hand that had sewn up a bleeding artery with a needle designed for stitching boots while incoming rounds collapsed the roof overhead. Muscle memory was a form of trauma, and her muscles remembered exactly what they needed to do. "He'll be dead in 2 minutes if we move him," she said. "No, please." No apologies. Just the statement of fact, delivered the way she'd been trained to deliver facts when the alternative was letting people die. "His aorta is dissecting. If you move him, the shearing forces will rupture it completely. He needs a thoracotomy. Now. I can do it here, or you can watch him die in a hallway." Sarah Hartley made a sound, not words, just a sound like something inside her was tearing in sympathy with her husband's anatomy. Jennifer, the new graduate, stepped back automatically, her body recognizing authority even if her brain hadn't caught up yet. Ashford moved toward her, and for a moment Katie thought he would try to physically stop her. She let him see, in her eyes, that he could try. That it would be interesting. "If you do this," he said, "you're finished here. I'm calling the chief of staff. I'm calling the board. You will never work in this hospital again." Katie's hand was already tearing open the sterile packaging. The scalpel felt right, felt like coming home to a place she'd spent her entire adult life trying to leave. She looked at Ashford with the kind of clarity that comes from understanding that some moments require you to burn everything behind you, because the alternative is unacceptable. "I'm done," she said. She didn't wait for his response. She moved instead to the colonel's bedside, her hands finding the landmarks on his chest, the space between the ribs, the position for an emergency thoracotomy, the same procedure she'd performed with a combat knife and a prayer in Helmand Province when a Marine with her exact injury had taken shrapnel that turned his insides into a geography of bleeding. She felt her left hand, the 3-fingered hand, the hand that the hospital's HR department had been quietly concerned about, steady the retractor with absolute precision. The scalpel cut clean. There was no trembling, no hesitation, no moment where her body betrayed what her mind understood. There was only the focused silence of someone who had trained for a decade to perform this exact procedure under circumstances far worse than a temperature-controlled surgical suite with all the equipment she needed. Blood. The smell of it, sharp and urgent, cutting through the antiseptic like a reminder that bodies were just containers for chaos, and sometimes you had to open the container to stop the chaos from spreading. She clamped the aorta, a satin sky clamp that held the vessel steady, and suddenly the colonel's vital signs paused their death spiral, the blood pressure stabilizing, the heart rate dropping from the desperate climbing panic to something that looked almost compatible with life. She could hear Ashford on the phone in the hallway, his voice tight, "Get me security and the chief of staff. And call the chief of surgery. Now. We have an unauthorized procedure in progress in ICU room 312. Katie worked in focused silence, her 3-fingered left hand holding steady, her right hand checking the clamp, assessing the damage. The aorta had dissected almost completely, peeling away from itself like something dying. Another 5 minutes without intervention and the colonel would have been decorating the ceiling of a hospital corridor while his wife screamed. Another 10 minutes and he'd have been dead on arrival anywhere in the continental United States. The surgical team arrived, the actual surgical team, the ones with the legal right to be there, and Katie stepped back, her hands coming away from the colonel's open chest with the same precision they'd entered it. His vitals were stable. His wife was sobbing, but it was the sound of relief rather than grief. The dog tag on the bedside table gleamed under the harsh fluorescent lights, and Katie could see it from where she stood, the same stamped call sign as her son's, the same military issue, the promise that someone was watching, that someone would carry the story home. 2 security guards entered the room, and Katie met their eyes with the calm of someone who had already made peace with what came next. She set the scalpel carefully on the instrument tray, and somewhere behind her, she heard Dr. Ashford's voice, sharp, panicked, trying to construct a narrative that made sense. She performed surgery without authorization. She falsified credentials. She violated every protocol. But Sarah Hartley was looking at Katie with the expression of a woman whose husband had just been pulled back from the edge of death, and in the ICU bay, the surgical resident was already marveling at the precision of the dissection clamp, at the way the procedure had bought them exactly enough time to intervene properly. Katie didn't resist when the security guard placed a hand on her arm. She simply allowed herself to be guided toward the door, her limp more pronounced now that the adrenaline was fading, her 3-fingered left hand hanging at her side with all the weight of every choice she'd made to get here. And as the guards moved her into the hallway, away from the colonel and his wife and the dog tag that wasn't hers to keep, she could hear the surgical team already moving with purpose toward the operating room, could hear the beeping of monitors confirming that Colonel James Hartley was going to live, and that was going to change everything. The surgical team moved past her like water around a stone, their focus already shifting to the operating room, to the machines that would finish what her hands had started. Katie's 3-fingered left hand trembled, not from fear, but from the specific exhaustion that comes after your body runs on pure muscle memory and adrenaline for 8 minutes straight. She looked down at her palms. Blood under what remained of her nails. The colonel's blood, mixing with the antiseptic that had soaked into the creases of her skin during the procedure. She didn't need to be told to move toward the sink. Her body knew the way, the same way it had known how to position the retractor, how to find the descending thoracic aorta despite the blood, how to clamp it with the precision of someone who'd done this in a dirt-floored aid station outside Sanjin Valley with nothing but a headlamp and the sound of outgoing fire. She scrubbed methodically. Soap. Water. The blood circled the drain in lazy crimson spirals, and she watched it disappear into the pipes like watching her shift at Seattle General disappear the same way. Dr. Ashford stood in the hallway outside the surgical suite, his face the color of old hospital walls. He'd watched the entire procedure from the doorway, watched her move with a precision that made every correction she'd ever offered him look less like insubordination and more like an act of mercy. He'd watched her save a man's life with one hand. His hands had been empty. She heard his footsteps moving away, already reaching for his phone before he'd cleared the ICU doors. Katie dried her hands carefully, her missing fingers making the motion asymmetrical, and something in that asymmetry felt like the entire truth of her life, what remained after the sacrifice, and how you learned to function anyway. The first call came through at 14:24. Katie was still in the surgical locker room when she heard rumors filtering down through the nursing staff. Dr. Ashford had called the chief of staff directly. The words, unauthorized procedures, massive liability exposure, protocol violation, spread through the hallways like a contagion. The second call hit HR at 14:52. Katie heard it from a resident who'd overheard the department head on the phone, patient endangerment. Falsified credentials. Insubordination. Each word was a brick, building something solid and immovable. The third call to the hospital board happened at 14:58. Ashford's voice, Katie would later learn, had carried the specific urgency of a man watching his reputation crumble and reaching for whatever tools remained in his arsenal. We need to move fast before her union rep arrives. I have documentation of protocol violations going back months. It was efficient. It was calculated. It was exactly the kind of strategic competence that made Ashford genuinely dangerous, not a bully, but a man with the institutional knowledge to weaponize bureaucracy itself. The chief of staff arrived in person at 15:04, his face arranged in the particular expression of someone who'd been given marching orders and didn't enjoy them. He didn't make eye contact with Katie. He simply nodded to the security officer standing near the locker room entrance, the same guard who'd escorted her out of the ICU after the procedure, the same man who now held his radio with the patient resignation of someone following a script. Ms. Rodriguez, the chief of staff said, and his use of her civilian name felt like the first official erasure. We need to process your termination. HR is ready for you. Katie nodded. She'd known this was coming the moment Ashford's jaw clenched while she was performing the thoracotomy. She'd seen it in his eyes, not anger, but humiliation. And humiliated men with institutional power didn't forgive. They eviscerated. The HR director was a woman named Patricia Weinstein, someone Katie had smiled at exactly 3 times in 8 months and who'd always smiled back with the particular warmth of people who didn't know you yet. Patricia wouldn't meet her eyes now. She kept her gaze fixed on the personnel file open on her desk, her hands flat on either side of it as if trying to contain something that might escape. Ms. Rodriguez. Patricia's voice had the texture of breaking glass. Effective immediately, your employment is terminated for violation of hospital protocol, unauthorized medical procedures, and insubordination. You'll be escorted to collect your belongings. Security will accompany you throughout. The words landed like ordnance. Efficient. Final. The kind of institutional language that transformed a person into a problem to be disposed of. Katie's supervisor had already boxed her locker. There wasn't even the dignity of doing it herself. A cardboard box sat on the HR office floor, held together with hope and packing tape that was already beginning to fail. She could see the edges of what remained of her civilian life, a cracked mug from Marcus's boot camp graduation, navy blue, and slightly chipped at the rim where he dropped it celebrating his commissioning. A dying succulent she'd watered every Friday for 8 months, now bent and withered, its leaves the color of rust. A framed photograph of Danny Rodriguez in his dress uniform, taken 3 weeks before the IED outside Marjah took him and 2 fingers from Katie's left hand. She picked up the box. It was lighter than it should have been, as if 8 months of trying to build a normal life weighed almost nothing when reduced to cardboard and contents. The security guard waited by her side with the specific patience of someone just doing his job. His name was Marcus too, she'd learned that in week 2, had made it a point to remember small facts about the people around her because that's what people who belonged did. They learned names. They asked about children. They existed as more than just bodies moving through space. They walked her through the hospital like a prisoner of war being processed. Past the nurses' station where 2 RNs suddenly became very focused on their computers. Past the break room where the evening shift was just beginning their meals, where the door opened for just a moment and Katie caught the reflection of her own bloodstained scrubs in the glass before someone pushed it shut. Past the unit board where her write-up still hung, printed and laminated like a warning to other people who might consider reaching above their station. The automatic doors hissed open. Norfolk rain hammered the pavement outside like it was trying to drown something. It was 15:23. 3 hours and 36 minutes since she'd heard the code alarm and made the choice that had led to this moment. 3 hours and 36 minutes to undo 8 months of careful invisibility. Katie stood at the bus stop, the cardboard box growing soft in her hands as rain soaked through the bottom. Water darkened the tape. Her hearing aid crackled with moisture, that particular feedback of electronics meeting humidity, and she reached up to adjust it automatically, a gesture so ingrained it was almost unconscious. Her 3-fingered left hand ached in the cold. She flexed what remained of her ring and middle finger, feeling the phantom sensation of the 2 fingers that had stayed behind in Afghanistan, left with her husband and 21 other soldiers she'd failed to save despite 16 hours of trying. A bus splashed past the stop without slowing. The number 14, heading toward the waterfront. Katie watched it disappear into the rain-soaked afternoon. Another bus would come. That's how systems worked. You stood and waited long enough, and eventually something arrived to carry you away. She could go back to the apartment. She could call her son. She could figure out what happened next, how to survive another termination, how to explain to Marcus that she'd been fired for saving someone's life. Her right hand, the intact one, slipped into her scrub pocket. The dog tag was there, still warm, the broken chain cutting into her palm. She'd grabbed it instinctively when security moved her toward the door, the same instinct that had made her perform a thoracotomy on a man she wasn't supposed to touch. The same instinct that had kept her alive in Marjah when everything else had become incomprehensible. The dog tag belonged to Colonel James Hartley, who would now live to recover, to return to his command, to see his wife again. It belonged to the 75th Ranger Regiment, and the operations his team ran in darkness that never made the news. It belonged to men like her son Marcus, who wore an identical dog tag under his dress uniform and who would come home someday to a mother who'd saved his commanding officer's life and then lost everything for it. She curled her fingers around it, 3 intact fingers plus the 2 remaining partial ones, her whole maimed left hand gripping that promise. The rain fell harder. The cardboard box disintegrated incrementally. And Katie Rodriguez stood at a bus stop in Norfolk, watching her entire civilian life dissolve into grey water and institutional memory, holding onto something that wasn't hers to keep but which she would never let go. But she had no idea what was about to walk through those hospital doors in exactly 180 minutes. 3 hours. That was how long it took for Katie Rodriguez to go from cardboard box and rain to the center of an institutional earthquake she never saw coming. Marcus burst through the administrator's office door like a man who'd already survived worse and had nothing left to lose. At 16, he moved like his mother, controlled, purposeful, every motion calculated. In his hands, a shadow box. Inside, medals arranged in precise rows on navy felt. The glass caught the fluorescent overhead light and threw it back like a warning. Dr. Ashford sat behind his mahogany desk, reviewing Katie's personnel file on his tablet, the screen glowing with the falsified credentials he'd carefully inserted into the system. He didn't look up when the door opened. He didn't need to. In his mind, the narrative was already written. The quiet nurse with the hearing aid and the missing fingers had been erased. Professionally, legally, completely. Then Marcus slammed the shadow box down so hard the medals jumped. The tablet clattered to the floor. "Mom, they need to see these." Marcus's voice cracked, teenage and furious and carrying the weight of understanding exactly what his mother had sacrificed. "You can't let him win. You can't. Not like this." The chief of staff emerged from the back office, then the head nurse, then the hospital's legal counsel. They'd been waiting, all of them, for this moment. Not knowing what moment it was, but sensing the ground had shifted. The head nurse picked up the shadow box with trembling hands. She opened the file, the real file, the one that had arrived via Pentagon courier 45 minutes earlier, countersigned by JSOC. She read aloud, each word landing like a verdict, Major Katie Rodriguez. Combat Medical Badge. 2 Bronze Stars. The Chief of Staff went pale. A man in civilian dress uniform stepped forward from the corner of the office where he'd been standing, silent as a ghost. Captain James Mercer, Delta Force liaison, attached to Colonel Hartley's recovery team. His rank was immaterial. His presence was everything. He stood at parade rest, a living announcement that this was no longer a hospital matter. This was a federal matter. "Purple Heart," Mercer said, his voice steady as a metronome. Army Commendation Medal with Valor. She held a field hospital under fire in Marjah for 16 hours. 300 rounds. 2 IEDs within 200 meters. 23 operators walked out of that compound because this woman refused to evacuate. He paused. Each beat of silence was a hammer strike. She held them together when the walls were coming down. When her own hands were bleeding. When she was deaf in one ear and missing 2 fingers on her left side. The file trembled in the head nurse's grip. The door opened again. 2 federal agents, FBI credentials on their belts, entered without knocking. One of them held a warrant printed on cream-colored paper that looked like it weighed 1,000 pounds. They'd been waiting in the hallway for their cue, the signal that Dr. Ashford had finished digging his own grave and was now standing in it. Dr. Edmund Ashford, the senior agent said, reading from the warrant, "You're under arrest for federal crimes of evidence tampering, obstruction of justice, and falsification of medical records. You have the right to remain silent." Ashford stood up from his chair like a man moving through gelatin. His mouth opened. Closed. He reached for the tablet, but the younger agent was already photographing it. The screen showed everything, altered files, inserted false credentials, timestamp stamped deletions of Katie's commendations from the hospital's personnel database. Evidence of prior tampering in at least 14 other cases. Nurses who'd been fired. Doctors who'd lost their licenses. A pattern stretching back 7 years. "This isn't, I was just reviewing," Ashford tried, but his voice had become something small and thin and utterly unconvincing. The agents cuffed him. The metal clicked with a finality that sounded like a closing door. They walked him out through the hospital corridors at 3:15 in the afternoon, shift change time, when the hallways were crowded with nurses rotating through their stations. Every single one of them stopped and watched. The woman who'd been told to step back during a code. The man who'd removed 3 nurses from the floor and replaced them with his allies. The administrator who'd smiled while announcing their terminations. Ashford's eyes met theirs as he passed. No apology lived in that gaze. Only the shock of consequence. The man who'd built his entire career on institutional power, relationships, reputation, carefully cultivated alliances, watched it evaporate in the time it took to descend one flight of stairs. By the time he reached the ground floor, his medical license was already flagged. By the time the federal car pulled away from the curb, his board memberships had been notified. By dinner time, his name would appear in 3 separate federal databases as a cautionary tale. 6 months later, Katie Rodriguez sat behind a desk in the Pentagon with her name and rank on the door in raised brass letters: Major Katie Rodriguez, USA, RET, Veteran Medical Integration. The office was small but deliberate, with a single window overlooking the Potomac. Her 3-fingered left hand moved across the keyboard with the same precision it had once used to hold field surgical instruments. She was writing policy recommendations that would change how veteran medical professionals were recognized and protected in civilian hospitals across the country. Mandatory credential verification before disciplinary action. Protected reporting channels for nurses and staff. A veteran status flag system that would alert administrators when they were making decisions about someone who'd already served. The policies had her fingerprints all over them, literally. The formal signatures required her full, 3-fingered handprint on every page. No one asking for accommodations. No one apologizing for what was missing. Just the clear, undeniable evidence that she'd signed them. On her desk sat 2 objects that caught the afternoon light coming through the window. The first was a dog tag on a broken chain, the one she'd kept safe through termination, through the bus stop in the rain, through the silence of not knowing if anyone would ever understand what it meant. The second was a photograph in a military-grade frame. Marcus in his dress uniform. Delta Force ceremony. And standing beside him, fully recovered, barely favoring his left side, was Colonel James Hartley. His arm was around Marcus's shoulders. He was smiling like a man who'd been given a second chance and knew exactly how rare that was. Katie's hearing aid, newer model, government-issued, military-grade, picked up the sound of her administrative assistant typing in the outer office. The clarity was remarkable. She heard everything now. The fluorescent lights humming at 60 Hz. The distant throb of traffic on I-395. A helicopter passing overhead, probably from Bolling Air Force Base, its rotors creating a sound like distant thunder. She picked up the dog tag and held it up to the window. The metal caught the light and threw it back like a beacon. Somewhere out there, Marcus was wearing its twin. Somewhere out there, Colonel Hartley was healing, learning to breathe like a normal man again instead of a man living on borrowed time. The email came through at 4:27 in the afternoon. Subject line: Priority request for national implementation. It was from the Secretary of Defense's office. They wanted to expand her protocols nationwide. Veteran Affairs Medical Centers. National Guard facilities. Every hospital that treated military personnel. They wanted her to spend the next year rebuilding the system from the foundation up, ensuring that no quiet person in scrubs ever got erased again. Katie read it 3 times. Then she closed her laptop and sat very still for a moment, listening to the sounds of her new world, the leather of her chair creaking, the hum of the fax system, the distant pulse of the nation's capital. She thought about a bus stop in Norfolk and the weight of a cardboard box falling apart in the rain. She thought about the choice she'd made, not to accept reinstatement, not to take back pay and apologies, but to build something instead. Meanwhile, in a strip mall between a nail salon and a discount shoe store in Norfolk, Dr. Edmund Ashford sat at a folding table trying to sell supplemental insurance policies to people who were mostly looking for the nail salon. His medical license was permanently revoked. His name appeared in every credentialing system as a red flag. The only work available to him was this, commission-based, humiliating, watching former colleagues walk past without acknowledgement. One of them did exactly that at 4:52 on a Thursday afternoon. A colleague he'd known for 15 years. She saw him, registered his presence, and kept walking as if he were part of the architecture. Air, wall, Ashford. All equally irrelevant. Katie never spoke publicly about what happened. She didn't need to. The policies carried her legacy. The changes at Seattle General spread to 3 other hospital systems within the first month. Mandatory credential verification. Protected reporting channels. Anonymous error systems that protected nurses from retaliation. The head nurse sent her a message 6 months after Katie's hiring at the Pentagon: "We implemented all the changes you requested. I'm sorry we didn't stand with you when it mattered. Thank you for standing anyway." Katie didn't respond immediately. She looked at Marcus's photo. She looked at the dog tag on its broken chain. She looked at the dying succulent she'd carried from Seattle General in a cardboard box, now thriving in a Pentagon office, replanted with care, proving that things could heal if you gave them time and didn't give up. Finally, she typed, "Teach your nurses that the quietest person in the room might be holding it all together. And that's exactly who you should listen to." She hit send and closed her laptop. Then she grabbed her jacket and headed to the Walter Reed VA Hospital, where she volunteered on weekends, teaching combat medics how to navigate civilian medicine, showing them how to transition from the language of war to the language of healing. She was building a bridge made of her own bones, standing in the middle, refusing to let anyone else fall through. The helicopter overhead passed again, its rotors thumping against the Washington humidity. Katie stepped outside and looked up, watching its silhouette cut across the sky. Somewhere up there, someone was going to war or coming home. Either way, when they landed, there would be nurses waiting. And some of those nurses might be hiding the kind of strength that comes from having already been broken and choosing to heal anyway. Those were the ones worth listening to. If this story resonated with you, if you've ever been underestimated by someone who didn't know your true value, or if you've ever chosen integrity over convenience, please subscribe and hit that notification bell. Share this story with someone who needs to know that quiet strength is still strength. And comment, what would you have done in Katie's position? Would you have taken the reinstatement, or would you have walked away to build something better? Your voice matters. Thank you for watching.